So then the question becomes, okay, I got the disruption. I see that, I see what's happening. How do I deal with this? How do I organize for this? What can I do about this? And let me touch on that for a little bit. This quote from David Rose is the one that's been stuck in my head for a long time. He made a comment that all of our organizations, institutions, organizational structures are top-down pyramid, hierarchical type organizations built for efficiency, built for predictability. But today, those operations don't work in the same way. Today, you need to be organized for agility, flexibility, adaptability, speed. And our old organization structures don't operate in this way. As a simple example, there is no MBA program in the world that can teach you how to build Uber. Every MBA program in the world teaches you how to build a 20th century organization. And so we noticed over the last 10 years that there's a totally new breed of organization that's being created that we have never seen before. And so we'd spent some time, 2 years of research, analyzing what is it that makes these new organizations operate. The definition is they're delivering minimum 10 times better, faster, cheaper than the status quo. Very briefly, these organizations all have what I call a massive transformative purpose. Like Google organized the world's information, or Uber is everybody's private driver. Then they're leveraging 5 externalities, not hiring their own staff. TED uses community, Google uses algorithms, Airbnb is leveraging other people's assets, and so on. Okay? Then there's 5 internal mechanisms like the lean startup methodology, constantly iterating processes, real-time dashboards, decentralized organizations, and so on. Here's an example called Github. GitHub is a social platform where developers, software developers, can collaborate. They use all 11 of these characteristics, all 11. They have no staff. They outsource all work to the community. They have a global community of about 30 million developers. Microsoft just bought this company for $7.5 billion with no assets, no workforce, no intellectual property. Right? That's what's possible. And let me give you the analog for where this applies to healthcare. GitHub has been so successful, they have a Yelp type rating where you can look at my software and give me a rating on how good my software is, and I can look at yours, and they've created a peer-to-peer rating system on people's software. It has been so successful that if you're a software developer in Silicon Valley today, your salary has 0 bearing on the school you went to, the university you went to, the degree you got, or the grades you got. It's 100% what is your GitHub rating. So the value of a computer science degree just went to 0. Because if I'm a good developer, I don't need the degree. Now, over time, that will apply to healthcare. Regulatory prevents it for a while, but we know lots of people that are great diagnosis, great diagnostic capabilities, or have incredible intuitive capabilities, or have a great sense of what to prescribe, et cetera. And those will filter to the top in some mechanism like this. It may take longer, but it's going to happen. So here you have an open, peer-to-peer meritocracy driven by community that is going to has already replaced the value of a computer science degree in a traditional sense. Right? And so this is going to start to happen in more and more domains. The question is, how do you deal with this? And the way you deal with this is you become one of these. You build community. This is why I love the title of this topic, is how do you connect? How do you create your patients as a community, or your hospital as a community around it? And you can learn from that community. What we're seeing in community-driven organizations today is they build a community, and then they simply have to ask the community, how can we serve you better? And the community tells them. Gone are the days where you had to have somebody have 30 years of experience in that sector trying to figure out and guess what should be happening.